Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking on the inside part of the knee. This is the medial compartment. We have a shaver coming in, and here you can see some of the area on the femoral condyle where you've lost some cartilage. You can look up at it right here. See these little areas here. Sometimes that can be a source of some of your knee symptoms. I just want to make sure nothing's loose here without removing anything that's still reasonably healthy. We'll look back this way. It gives us a better view of this defect or this injury in the femoral condyle. You can see it's right here. It measures about 4 millimeters by 4 millimeters, maybe a little bit bigger. Yeah, closer to 10 millimeters there. So, but that gives you a pretty good idea of this area right there. Okay? So you can see it's a little bit soft. I don't really have a separate treatment for this type of thing except our orthobiologic injections in the office. These are the types of lesions where we can often help minimize our patient's pain with PRP or a bone marrow-derived stem cell injection. So not required, but that's just a potential option if you continue to have symptoms. So now as we look towards the back of the knee here, the meniscus looks pretty good. As you look at the posterior horn of this medial meniscus and use this instrument as a probe, that also looks pretty good. We'll go ahead and look up at the ACL. And here's your ACL. That looks pretty good. That's the anterior cruciate ligament. So I'm actually happy with the way that looks. And next we'll go over here and look in this lateral compartment. Down on the knee? Okay, so now we're looking in the lateral compartment. We're looking at the lateral meniscus, which is this structure just below the shaver here. I'm touching the edge of it here. This inner edge appears pretty stable. So I don't think there's much to worry about there. We'll have a look at the posterior horn here in just a second. So here's posterior horn. The root back here is stable. And the body here that we were just touching looks pretty good too. Push down right there. So I'm not seeing anything else so far to worry about in this lateral compartment, so that is also good news. Okay. You've got some wear and tear changes, so you've definitely got some arthritic change that we can see here on the tibial plateau. See these areas here? Right at the tip of the probe there. This is an area where the cartilage, again, is soft, just like we saw in the medial femoral condyle. So no great treatment for that other than some of our orthobiologics. There's some evidence that those may help strengthen and support these areas that are breaking down. But you can see the more normal cartilage is going to be up in this region. And this is the stuff that's starting to break down a bit here. So now we'll look up at the patella and at the patellofemoral joint in just a minute. Okay, so now this is, I think, one of the main issues that's bothering you. As we look under your patella, you can see this is hanging down and creating these mechanical symptoms. And so we're going to get our shaver to work right on this area here and debride this patella. There's a matching injury in the trochlea right here. And we've got to work on that side also. As we look down the front of the trochlea, we can follow it all the way down to the front of the knee. So all down here, this is all fine and smooth. We start to get abnormal on the lateral aspect of the femoral condyle here. And that's what concerns me. So we don't want to take away anything we don't have to here. We'll show you some more in just a minute. Okay, recording. Okay, so now we're looking from the medial side. It gives us another angle to try and debride this patellar cartilage that's loose and creating all these symptoms for you. Okay, so as you look at the trochlea, you can see the defect here. And you can see how this is a little bit loose. I'd rather not remove all that cartilage if I could avoid it, but I think it's clearly not normal here. Okay. But if it doesn't come to the shaver, I don't want to, if I remove that, it's going to leave a defect from here all the way up to here, and I'd rather not do that unless I absolutely have to, especially if I can convince you to do a stem cell injection in the office. That might actually heal that or stabilize it on its own without removing the cartilage. So as we push in and look up at the rest of this patella, I think we're just about done working on the absolutely loose pieces. Okay, so we're just about done. We're trying to firm up the cartilage that's left. That's about the best I can do here, again, without taking out a bunch of that. I'm on the fence about it, to be honest with you. I just don't like the fact that it still looks a little bit unstable to me. We'll keep working and show you the finished area, but you can see this is the outline of the area that we're talking about here. And with very low heat, we can just try and make sure that it's stable. Okay, well, okay, so we're just about done here. We're just flushing the knee out with a bunch of salt water, basically. Okay, so this is our finished picture here. Given what we started with, I think that's reasonable. We'll go ahead and finish up here and get you back to the recovery room shortly, okay? So good luck to you now. We'll talk a bit more in the office, obviously, about some other options going forward. Bye-bye. Stop.